Those on the front lines of the opioid crisis tell us they're not surprised that there's been a spike in overdoses in Toronto. It's what they've been witnessing for months now. But they do point to recent provincial changes as the reason why paramedics specifically are getting more calls this holiday season and putting more strain on the healthcare system.
We need to have an urgent response. This is an emergency.
New calls for an urgent response after Toronto Public Health released data painting a grim picture of opioid-related overdoses in the city. Between December 20th and 28th, Toronto Paramedic Services responded to 122 calls, 35% higher than the average number of calls in the same time period in 2023 and 2024. It was deemed a significant enough increase to warrant a drug alert.
I wish they could share the data all throughout the year because people are walking around with their eyes closed to a tragedy all around them.
The director of Toronto's drug checking service confirms the street fentanyl supply that she's seeing is increasingly more contaminated and less predictable. But she believes the increase in calls to paramedics is a result of the Ford government's decision to close supervised consumption sites that are within 200 meters of schools or daycares.
There aren't other services for people at highest risk of overdose to access. Many of the province's supervised consumption services have been closed. Those were services that directly, responded to overdoses and would alleviate some of the burden associated with those types of calls on our system.
We are standing in one of just 5 supervised consumption sites that remain open in Toronto, and they are swamped this holiday season as more people come through their doors than ever before.
We had our busiest month last month in November. It's not a surprise to me that there's been this spike. It's something that we all predicted would happen with the closure of so many supervised consumption sites in the city.
Water, tourniquet.
The Kensington Market overdose prevention site, run by the neighborhood group, no longer receives any provincial funding. They rely solely on fundraising to keep their doors open.
This has been our worst December in years, and we're at our breaking point in terms of fundraising to stay open.
They tell us they are reviving 2 to 3 people a day on average.
I do have concerns. We're a small site. We have very few staff. And yeah, I do fear what's going to happen.
They are located close to a childcare center, and the only reason they remain open is because they challenged the province's ban in court, claiming it infringed on their charter rights. They are still awaiting the court's final decision. The health minister's office tells us in a statement that instead of giving people tools to use illegal drugs, they are investing in more mental health and wraparound supports, including $550 million to build 28 new homelessness and addiction recovery treatment hubs across the province. For City News, I'm Tina Yazdani.